Good afternoon, students. It's a request of my DNB student, Dr. Sajjan Kumar, to take a class on the prescription. And it is the responsibility of the teacher to abide what the student says. I have decided to take this classes on the prescription. Practice for a doctor. Patient will definitely visit his chamber, and when a patient visits his chamber, what he does, he takes the history and he asks for some test, and after the test, he arrives at a diagnosis, and after arriving at a diagnosis, the different possibilities are, he may ask the patient, go for surgery, he or she may ask for the physiotherapy, radiotherapy, he may ask for the psychiatric counseling, or he may ask for the second opinion because of the era of the super specialist opinion, or he may prescribe the drug. Now, what is prescription? The prescription is a written order. It is a written order by a physician, qualified physician, to prepare some drugs, and the instruction to the pharmacist so that that can be compiled, that can be given in a suitable dosage form, and to the patient so that it can be taken in a suitable dosage form. So it contains the two directions, one to the pharmacist and one to the patient concerned. Now when you arrive at a diagnosis, in a prescription, what are the things you keep in your mind? Number one, what is the disease? What do you want? So the disease process, you must know what is the pathophysiology, specific diagnosis. Knowing the pathophysiology, you must set what is your therapeutic objective. And after setting the therapeutic objective, you should select your drug of choice. Then you must know what is the dosing. Appropriate dosing has to be done, and then after the prescription, you must observe the end point. What is the end point? What do you want as the end point? As for example, the fever or blood pressure should be controlled, or the diabetes should be controlled, the end point should be pinpointed, and at the same time you must observe for the adverse drug reaction. As for example, hydroxychloroquine, it may lead to the retinal damage, and periodic ophthalmoscopic examination has to be done. That is also responsibility of a physician. Prescription in earlier days written in a certain different format, and the format has been changed nowadays. What is the older format? In the older format, name of the doctor, name of the patient, registration number or the license number has to be there, in which date the prescription is made. Classically, the time should also be mentioned. Superscription, which is symbolized by this symbol. That means you take down the following drugs and get cured. In fact, this symbol indicates the king of the Roman gods, Jupiter. That means you pray to the Jupiter, let my patient take the following drugs and get cured. Then comes the inscription. In the head of the inscription, there are four heads. One is the base proper, that is the drug proper. Then adjuvant, that means something is mixed with the drug so that its action is enhanced or it is better absorbed. Then comes your corrective. The corrective will take care of the bad test, and then comes your vehicle. Ephedrine, here is the potassium bromide. You will the corrective as a syrup, glyceridia, and the vehicle as a water. water, so that just two dose can be adjusted. And after the inscription comes your subscription. What does it mean? Subscription means is the instruction to the pharmacist, MFT mist. MFT mist, that means make and make a mixture. There's an instruction to the pharmacist, and then comes your Signa. Signa means is the instruction to the pharmacist, say 1 TSF to be taken 3 times a day, is the instruction to the patient, and then comes your signature. That means your signature initial. So this is the format, the classical format of a prescription in older days. Nowadays the format has been changed, and what precaution you have to take is like this. Say the name of the doctor. Name of the doctor. Say Dr. Sajjan. My student. Then comes his qualification. At present he is MBBS and will be DNB very soon after passing. Then his registration number or the license number. Then the drug, different drug, what you like to prescribe. Suppose he wants to prescribe amlodipine. So the amlodipine 5 milligram, 1 tablet daily. A bit fast. Now for how long? It has to be specified, say for the 15 days. Whether it can be refilled or not, that has to be specified. So refill allowed or not. There's a hypertensive, so the refill is allowed. But there are certain drugs that is given for a single time. Say the morphine, it is given for a single time. So refill allowed 4 times. So he can go to the pharmacy shop and take the drug for 4 times. Any instruction or the precaution. What precaution? Suppose he has prescribed an antihistaminic, on that time he has to write, don't drive vehicle. Or any other specific instruction you'd like to give, keep it away from the children. At the end, you write down, give your signature. So this is the format of a prescription of modern era. At the left-hand side of the prescription, important signs and symptoms. What for the patient has come, his vitals, what investigation here he or she has suggested should be written so that it can be followed out properly. There are certain things have to be kept in mind. So the prescription is made for the ambulatory patient who can come to your chamber. But in the hospital setup, what you do is called physician order sheet. Physician in the ward, what you do is instead of prescription, we call it the physician order sheet or chart order. Nowadays is the era of computer and the internet. In the advanced countries, there is a provision of the e-prescription. E-prescriptions are given by licensed doctors. The pharmacist can suggest what drug is available to him. As for example, he has got pantoprazole, he can say the pantoprazole is available to him, don't write omeprazole. What drug interaction can occur, that can also be, you can get an indication from this. Now in the prescription, there are certain things has to be kept in mind. What is that? At times, doctor prescribes off-label prescription. As for example, the chloroquine is meant for the malaria and presently it is being used for the COVID-19 virus. So this is an off-label indication. Now here comes the logic of legal matter. If you can substantiate the scientific basis of that. There are many examples of off-label prescription. As for example, cyproheptadine. Cyproheptadine is promoted as an appetizer, but basically is a 5-HT antagonist or histamine antagonist. There are many examples. In the developing countries, prescription should be done from the generic drugs. Now what is generic drugs? the drugs which are present in the market even beyond his patency. Generally, it takes 20 years. A company poses the patency of a drug for the 20 years. After 20 years, any company can manufacture a drug, same drug on that time. They need not have to pay that much of the license fee which is required for the first time to be introduced. So these drugs are called the generic drugs. It is the responsibilities of the drug provider to go for the prescription reconciling. Is an era of the specialist, and it is seen many a times the same drug are prescribed by different doctors. As for example, pantoprazole being prescribed to the orthopedician, and when this patient goes to a gastroenterologist, he also prescribes the pantoprazole. So the provider of the prescription should know what is the content of the prescription, so the repetition should not be done. So these are some of the facts of prescription, what one must know. Now many times we get failure as because the patient don't compile the prescription. Patient fails to obtain the medicine. We have prescribed a drug which is beyond the capacity of the patient to purchase it. The patient fails to obtain the drug. Patient fails to take the drug. Patient has taken a drug in a wrong dose, wrong frequency. Patient prematurely withdrawn the drug, and at times patient shares the medication with the others. These are the different reasons of the non-compliance of the patient. The doctor must have a thorough knowledge of the OTC drug and the licensed drug. It is a very common practice, particularly in the developing countries. The patient takes drugs consulting the pharmacist, what he calls the OTC drug or the non-licensed drug. So there are two types of drug. One is the OTC drug and one is the licensed prescriber. Before prescribing any drug, the doctor should inquire whether the patient has taken any OTC drug, because the potential danger for drug-drug interaction. Okay, this finishes in brief all about prescription. One should keep these things in mind while prescribing a drug. Thank you very much. And I don't know whether Sajjan has learned anything or not. And if you follow it, if you just read it further, I hope you'll be better prescriber than any other doctor. Thank you very much.